Hello, 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 and welcome to week 7 of HIT 500. Let's get into what we have. Okay, so let's kick this course off right. There are a few things that we know we have to complete, right? Knowledge checks. Continue to work on them. Try to score at least a 90% or above. Work on your apply and reflect. And of course, we're going to cover a good chunk during the live session. And this will all prepare you for that weekly feedback. Now, for everyone watching the playback, this is what we're going to discuss. Why do you think eating and drinking before surgery is not allowed? Find an article about the dangers of eating before surgery, and let's talk about it. There is going to be a lot more than what, you can vomit. There's so many more aspects to it. So let's talk about what we've discovered in the forum, all right? Okay, so what is the only number that has letters in alphabetical order? 40. And math is the only place where the truth and beauty mean the same. A little math trivia for us on this Wednesday. Now, we're talking about morbidity and other miscellaneous rates, okay? We're going to calculate based on morbidity, mortality, infection, postoperative infection, complications. We're going to look at the difference between a surgical operation and a surgical procedure. You do have questions on this, okay? I have seen it in your knowledge check, and I believe there's some on your final and feedback, all right? And then we're going to look at identifying attributes that constitute a clean surgical case. And this is all fun because this is my realm, right? Now, as always, we have to break it down. Now, preventing morbidity due to infection is an important clinical and quality management function. In 1970, the Centers of Disease Control and Prevention, the CDC, developed a voluntary reporting system. The NNIS, which is the National Nosocomial Infection Surveillance System, was tasked to monitor the incidence of any hospital-acquired infections, right? Now, when we look at nosocomial infection or a hospital-acquired infection, HAI, it's going to be the number of HAIs in the hospital for a given time period. And then we divide that by the total number of inpatient discharges, including deaths, for that same period. So everybody discharged, we're looking at who actually had something, and like it says, it's including those who have passed as well. Now, in the example, in May, community hospital had 360 discharges, 4 of whom developed sepsis while in the hospital. What you're doing is calculating the sepsis infection rate for the facility and rounding to 2 decimal places. So you get your infection rate. You have your 4 sepsis patients divided by the 360 discharges. It's giving you 0.011, right? But remember, you have to convert this to a percentage. And then from that percentage, the instructions tells us that we are looking at 2 decimal places. So then that brings us to 1.11%, okay? So that's just looking at infection rate, okay? But there may be increased morbidity, as you guys can see, mortality, and it does increase how much the healthcare costs are. It can occur after surgery. A lot of people think, oh, if it's a postoperative, it's right after. Well, there's a certain time period that we're going to go over. Now, the CDC estimates that SSIs account for 31% of all hospital-acquired infections. Even though hospitals really try to avoid, a patient getting an infection after surgery, unfortunately, they still occur. Now, remember I said we had to differentiate between a surgical procedure and a surgical operation. A surgical procedure, any single, separate, systematic process upon where the body can be complete, where we can go into the body and it's complete on itself. Now, this is going to be normally in a physician or maybe a dentist or any other licensed practitioner. It can be performed with or without instruments. And it's really done to perform or to restore any type of disunited or deficiency in the body, or maybe they want to remove something that's diseased or injured, tissues, foreign objects, maybe taking out a tooth, right? But the body itself is still really intact. A surgical operation, on the other hand, is where you're looking at one or more surgical procedures performed at one time for one patient via a common approach or for a common purpose. When we look at surgical operations, the easiest one to come to mind is an appendectomy. We're actually cutting into the body. So we are separating the body, right? Going inside and removing the appendix. When we look at a surgical procedure, think of a teeth extraction. You're not really, you're opening up the mouth, but as far as the body itself, it's intact. All right. And you will see questions on the differences of a surgical operation and a surgical procedure. Now, postoperative infections or SSIs occur after surgery, right? A surgical procedure, like I mentioned, is a single separate systematic process. The CDC classifies wounds into 4 classes: clean, where there's nothing going on, there's nothing bad; clean contaminated. Let's say we're going to do your mouth, right? Your mouth's considered clean contaminated. It's not necessarily going to be sterile. Contaminated, there's motor vehicle accident and there is, let's say, tree bark or something that could be contaminated. And then you have dirty or infected. Well, when the patient comes in and you definitely see like infection, pus, it's red, then you kind of definitely know, okay, yeah, that's definitely infected. So the 4 classes: clean, clean contaminated, contaminated, and dirty or infected go together. With that, the example we have now, we're looking at a postoperative infection rate. You see the formula in front of you, and our example states that during May, a hospital reported that 578 surgical operations were performed. The Infection Prevention Committee reported 3 postoperative infections in clean surgical cases. What we're doing is we're looking at May and we're calculating those SSIs. Key is we are rounding to 2 decimal places. We get our SSI rate. We have our 3 postoperative infections divided by our 578 surgical operations, giving us 0.00519. We have to convert that to a percentage. So we have our 0.00519 times 100, giving us 0.0519%. But remember, we are rounding to 2 decimal places. We look at that 9 that lets us know that we need to round that 1 up. Our answer is 0.52%. Okay. Now, according to the CMC, a complication is a condition that occurs during the patient's hospital stay that extends the length of stay by at least 1 day in 75% of cases. Complication rate is to determine if changes in the treatment of practice in the facility can prevent them from occurring again. All right. Now, when we look at examples of different complications, keep in mind that a lot of this you may not know is going to happen until you're actually in the operating room. Blood transfusion complications, it shows you vaccination reactions. One that we really don't like, as you guys can see up there, patients falling out of beds. It's not something we are like, yeah, okay, patients falling out of the bed. But that last statement, the last one up there, infections can be complications, but they are generally calculated separately. Now, calculating the rate. So you see, we do a lot of, hands-on, okay? So from July through December, Community Hospital had 32 patients with complications and 2,394 discharges. We're going to calculate the complication rate. And once again, we're rounding to 2 decimal places. So we get the complication rate. We have 32 patients with complications divided by 2,394 discharges, giving us 0.01336. We have to convert that to a percentage. So we get 1.336%. And again, we are looking at 2 decimal places. The 6 takes that 3 to a 4, and now we're at 1.34%. Now, cesarean rates is something else we look at. Hospitals determine the cesarean rate, which is the ratio of all C-sections to the number of deliveries, including C-sections during all specific periods of time. All right. So in this example, 40 C-sections were performed in a month, during which there were 350 deliveries, calculating the C-section rate for the month. We have our C-section rate equaling 40 C-sections performed divided by 350 deliveries, giving us 0.11428. Calculating that or converting that to a percentage, 11.428%. Again, 2 decimal places, letting us know that we're looking at 11.43%. And if you notice, you'll always see that leading 0 in front of the decimal place. We also look at consultations. Not every patient gets a consult, but there's often times where the patient will come in for one element and then something else arises, and so a consult will come in. The consultant has the opportunity to visit with the patient and review the health record, and then prepare a consultation report that includes the findings of the examination, recommendations for treating that particular patient. Now, the consultation report is made a part of the patient's health record, okay? So here in our example, during the month of May, Community Hospital's Medicine Unit had 103 discharges, 14 of whom were seen by a consultant. We're calculating the consultation rate. So we get our consultation rate, 14 patients seen by a consultant divided by 103 discharges. That gives us 0.13592, converting to a percentage, 13.592%. That 2 does nothing to the 9. So we're looking at a consultation rate of 13.59%. We're not done. There's other rates that can come in, okay? These are reported based on the healthcare facility's needs. You know, they want to have something, they feel like this needs to be counted, they can use the other rate. It may be reported to or for external agencies. And the best rule of thumb is just to use that other formula rate instead of trying to figure out something else. Just use the other rate. Now, you guys remember back in chapter 2, way back then, we did a mathematic review where we looked at the term rate refers to the number of times something has happened or part, and compared with the number of times it could happen being the base. This is where we're getting that other rate from. Now, the nosocomial or hospital-acquired infection rate is the number of hospital-acquired infections in the hospital for a given period divided by the total number of inpatients, discharges, including deaths for that same period. So the formula for calculating the nosocomial infection rate, you look at rate over part divided by base, gives you that other rate. Now, in this example that we have in front of us, in February, community hospital had 289 discharges and deaths. 12 of these patients had HAIs, hospital-acquired infections. And what we're doing is we're calculating that nosocomial infection rate and still rounding to 2 decimal places. So we get our HAA rate. We have the 12 patients that had hospital-acquired infections. We divide that by the 289 discharges and deaths, giving us 0.04152. And I hope you have your calculators. Trust but verify, right? We have to convert that to a percentage, 4.152. Remember, we only want 2 decimal places. So in this case, that 2 does nothing to the 5, giving us 4.15%. Now, it's a lot of formulas to kind of remember. So I'm gonna give you guys a second to screenshot this particular slide because this has all of the formulas for morbidity and other rates, okay? Kind of lets you know, all right, here, in case I kind of forget or so many different formulas to figure out, here it is. You know, you have your infection rate right off the bat, postoperative infection, complication, C-section, consultation, readmission, right? Give you guys a couple seconds to go ahead and click to get that. Okay. Now, as always, we work a little bit on your apply and reflection. So here, you are looking at using the information in the table below to answer the following questions. Use the leading 0 when applicable and round to the decimal places. So when they talk about that leading 0, they're just saying, make sure you put that 0 in front of your decimal place. So here we're looking at the consultation rate, including newborns. Now, you have your 2,789 consultations divided by your 8,191 adults plus your 809 newborns. 2,789 divided by 9,000 gives you remember that leading 0, 0.30988. Got to get that to a percentage, which is a 30.9888. We have an 8 though. So what is that going to do to our answer? That is going to give us a 30.99. All right. And so the further questions that you have like this particular section, you're just taking the information, plugging it into the formula, and make sure that you have that leading 0 if it's, 0 point whatever, all right? Next one. Now here, in this particular example, you're presented with a couple questions. You have a third-party review company reported the statistics in the table below. And what you're doing is you're calculating the rate of admissions approved for each month and for the quarter. And once again, you're rounding to 2 decimal places. So we have dealing with the month of September. So you do have July and you have August, right, as well. So you take the 920 number of claims approved for admission, and then you divide that by the number of admission claims reviewed. We still got to convert that to a percentage, 99.459. But remember, we are looking at 2 decimal places. What does that 9 do to the 5? 99.46%. Okay. You also have this chart, right? And you're going to have to calculate different mortality rates. Now, the ones I picked, we're looking at gross mortality rate for the semi-annual period. And what we're doing is we're using the information in the table to answer the questions. Now, here, we're looking at the number of deaths, 8,789,773. And then we're looking at the number of discharges, because remember, we're trying to get that gross mortality rate. So then we're taking 238 plus 264 plus 288, 292, 246, 220. Okay, so that's where I got these two. This is our numerator. These numbers are our denominator. We end up with 42 divided by 1,548. All right. Multiplying by 100 because we want to get that to a percentage. 2.71%. All right. And of course, you know, we have one more. Here we're looking at C-section rates for the semi-annual period. Now we're looking at these 2 rows here. All right. Once again, we take all the numbers from the number of C-sections divided by the number of actual deliveries. 35 over 839. I don't know why it's doing this. We get the number times 100. And we end up with 4.17%. Okay. So these are just the examples of some of the apply and reflects that you have. Now, the next 2 questions are going to be random knowledge checks that you will see maybe in this week's knowledge check section. So our very first one, blank means the state of being diseased or the number of sick persons or cases of disease in relation to a specific population. Would that be mortality, moribund, morbidity, or mordant? Blank means the state of being diseased or the number of sick persons or cases of disease in relation to a specific population. For everyone guessing, hopefully, morbidity. All right, next question. Now, from July through December, Community Hospital had 32 patients with complications and 2,394 discharges. What we're doing is we're calculating the complication rate, and then we're going to round to 2 decimal places. So what are our choices? Vanna White, we have 1.00%, 1.75%, 1.55%, or 1.34%.
I got the 1.34.
That is correct. Yes, 1.34%. Yes, yes, and yes. Good job. Now this brings us to the end of our live session. Now, I believe this will be the last week where we're doing actual math. I think the next couple of weeks are concepts. So for everyone watching the playback, we talked a lot about morbidity, HAIs, surgical procedures, surgical operations. Why do you think eating and drinking before surgery is not allowed? But the key is you're going to find an article. You can find a YouTube video. You can find a book, anything to show what you found about dangers of eating before surgery. And let's talk about what we've all discovered. Remember our math trivia? What is the only number that has letters in alphabetical order? 40. And math is the only place where truth and beauty mean the same thing. We went over chapter 8. We did a little bit of apply and reflect review or preview if you've already had the opportunity to look at it, as well as knowledge checks. This is our wrap up. Do you have any questions for me?
I do not.
Awesome. Well, thank you for being here. And I will see everyone who can make it next week in week 8. We are like fast speed going ahead. Have a wonderful weekend. Be safe. Good night.
Sounds good. Thank you. You too.